Yeah.
You are passionate about a concept of veterinary clinics that, again, mirrors this facility as a veterinary center, that there are ancillary services that you think should be brought under the umbrella of veterinary care. Tell me more about that idea.
Yeah, you know, as we started looking at the business and what's going on with it, you know, we have a lot of challenges going on within veterinary medicine today. And, you know, I'm trying to tell folks that I really don't believe competition is the veterinarian down the street or new clinics opening up in the area. When we sit back and review the biggest impacts on our business, it's been from businesses outside the traditional veterinary industry. It's the online pharmacies. It's the vaccine clinics that are opening up that are not veterinarians are working for them, but certainly not run by veterinarians. It's wellness clinics that are starting to spring up. Like the Walgreens is testing them. I keep telling folks Walmart won't be far behind. And so we've got a lot of forces outside the industry trying to take pieces of our veterinary business. And we thought, well, how do we stay competitive in an environment like this? And we thought, well, you know, it's time. As veterinarians, we're taught to do a lot of things, and yet we end up doing only a small portion of it. But if pet care is ultimately what we're about, in delivering the best pet care we can, let's look at everything we can surround that pet with, from puppy to that senior pet, to have them live a happier, healthier, longer life, okay? And so that said to us, well, why don't we look at some of these additional pet care services that we traditionally haven't done? I know we've done, a lot of veterinary clinics are starting to do boarding, but why not daycare? And why not combine daycare with training, okay? Because, God, we all know all those pets my own pets included, could benefit from additional training.
Right.
Okay? So why not provide that for people? Because people are real busy today, they're working all day, they don't necessarily have the time and energy to do that, but they'd love to have a pet that is better trained or better behaved or has a place to go so they're not bored at home all day. Why not let us provide it? Because who better to deliver pet care than us as a profession?
So a lot of practitioners and practice owners often say, I just want to do this for the medicine. So this idea of providing grooming and boarding and training, behavior classes, sort of out of their field, sometimes they feel of their expertise, and not what they wanted to do. So how do they make this happen?
Right. You know, and I totally agree with it, because honestly, dog training is not something I want to do. I mean, look at my dogs at home. Okay, it's obvious I don't, but they need it. Okay. I don't necessarily like to do orthopedic surgery. Okay. I like medicine, but I'm not an orthopod. We hired a doctor that does orthopedic surgery. We're hiring doctors who have an interest in behavior. We're hiring a doctor who has interest in alternative pain management, okay? So as a profession, we have hired people to help us build a team to do some of the things to deliver the medical and surgical services we have done in the past. So what's the difference? Let's hire somebody to do daycare. Let's hire somebody from a grooming perspective. Hire managers to be in charge of that, because I don't want to be running the day-to-day operations. I'll provide direction. I'll provide this is what we need to get from it. But let's hire the folks that we need to be able to deliver on this. And as veterinarians, we're used to doing that in medicine and surgery. Just expand it a bit, and let's get into these other services.
So I think you've demonstrated you're a very thoughtful, experienced business person in addition to veterinarian. Do you think this idea of a center for veterinary care would work in any demographic? Because I know here,
yeah.
I mean, you've selected a very nice, growing community for this center for veterinary care. Do you think this concept would work anywhere?
I think it would work anywhere. Tailor it to, if you think the clients have different needs, but tailor it to it. Any community you go into, you're going to find some daycare facility, you're going to find some grooming facility, you're going to find those services being offered. Yeah. So why not? I think it can be tailored to any community. You know, we may offer some real top-end things that you may not find other places, and that's fine. We'll do that if we can. Maybe you can't do that in some communities, but these basic services, I think you absolutely can. And you don't have to do all of them.
Right.
You don't have to do all of them. Pick and choose. But I think it's important as a profession, if we want to stay competitive, and if we're not doing it, Others are from outside the industry are going to come and take it from us. It's already happened. And so I am passionate about that. I think as a profession, it's not just the medical and surgical side that we're going to need to continue push and stepping up towards. We have to do it on the business end as well. And to me that means let's expand those services and offer additional pet care services, because when we're doing it well, I guarantee you the Walmarts and the Walgreens and the online pharmacies are not going to take that away from us, because who is more passionate about pets than veterinarians? It's why we go into it. Fits right into what we want to do.
You mentioned one benefit of having space devoted to daycare and boarding and training is that you can give pets that are having a difficult time for some procedure, maybe you can give them for a nail trim, take them someplace different to lower their stress level.
Yeah.
I see something happening today looking at the puppy daycare. These puppies get led around during the day into the treatment area, into exam rooms. You can tell that the clinic is not just a place they go to be afraid and poked and prodded.
Yes.
How important is it that there's ancillary services here, right here, next to the place where these medical procedures someday are going to need to be performed?
Absolutely, and we call some of those things just friendly visits.
Yeah.
And it's not just the daycare. We encourage clients to come in here for friendly visits. Bring your pet in, get him one of those neat toys, get him some treats, get a weight, walk them up and down here so they can see it and they can smell the other dogs and hear the other dogs. When they're in daycare, we want to do that as well. But it's part of our desensitization, so that they're not feeling that every time I walk in this place, something is going to happen that I don't necessarily like. Sometimes good things happen, and we think that's real important. So we call them friendly visits. So we do it with our daycare, we do it with just our clients. And this is an environment that allows them to do that. We want this to be a place, on Saturdays, we're not doing daycare, but we're going to open up the daycare area to come on in and bring your pet just to play in the morning.
Do you have a feeling for how compliant, when these are recommended, the happy visits or the friendly visits, what percentage of the clientele do you think actually take advantage of that?
Believe it or not, I think it's about half the clients will actually do that. And a lot of them are doing it because their pets are stressed, and we're trying to help reduce that stress level. And so the ones that we're really making that recommendation to, the pets that really need it, I would say half of the folks are really coming back and just scheduling happy visits. And we know the time they're going to be in, and so we try to work with them so that Dr. Talmadge comes out and gives their pet a treat. That's all I'm doing today, is giving their pet a treat as they're walking up and down. The technician's going to come out, and the receptionist. We're just giving treats and saying hi. And so, yeah, we're real pleased with that. And for us, it's part of the low stress handling, one of the tools that we use.
So we ask you've talked about possibly entering the hospital design competition in the future.
Yes.
We always ask everybody, I think, on the form, what's one of the things you wish you'd done differently in your facility? Is there one thing, now that you've already been, I know you've just had the open house, what is one thing you wish you'd done slightly differently?
I'm pleased with the layout for the most part. I think we have underestimated the demand for daycare and training services. I think if we had to do it again, I would look at, can we get a little more space dedicated to that so we can do more things with it. Mm-hmm. I'm finding that while we thought we had enough room for that part of the business, we don't, is what it's starting to look at, and we're just getting started with it. So I guess that's a good problem to have,
right.
But I would probably do more and take a closer look at that. If the area was zoned for boarding, I would love to include boarding. I think there is a real need for that.
So you would have done it if it were zoned for boarding?
If it were zoned, I would absolutely do it. And so, if we had to go back and if we could pick a different location, I'd make sure we included boarding as well.
Is there anything, you also devote a lot of your square footage here to what a lot of practice owners or veterinary architects, they always talk about, what's the revenue per square foot? Mm-hmm. They love a revenue per square foot of the treatment area because big procedures happen there, the exam room visits, and they always say, well, grooming, boarding, or retail, they say it just doesn't, the revenue per square foot isn't there.
Yeah.
Were you concerned with revenue per square foot when you envisioned the whole thing?
Yeah, and we certainly do look at revenue per square foot, and I'll tell you, a 2,000 square foot facility where all we were doing was medical and surgical services, your revenue per square foot was pretty darn good.
Right.
And so I can understand a lot of veterinarians saying that's all I want to stick with. I understand that. We were looking at a broader picture of being able to really do some more things for pets, and that model wasn't going to meet our needs. But here's the second thing we look at, cost per square foot, expense per square foot. Because a big open space like this, our cost to build that out, a lot cheaper than doing the veterinary side of it. So if you start to look at, it's not just cost or revenue per square foot, you've also got to look at what your expenses are per square foot, and then yes, look at the profit per square foot at the end of the day. And it's not necessarily as bad as you think. Certainly revenue per square foot may not be quite as high, but our cost per square foot isn't nearly as high either. So yeah, so we're happy with it. Here's what it does too, though.
Yeah.
And here's the thing that I don't think people take into account. When you start doing some of these ancillary services like this, and you start endearing yourself to your clients, and this introduces yourself to a lot more clients, because you got a lot of healthy pets coming into daycare services, to grooming and so forth. They start to become familiar with you as a business and a practice, and they start to like what's going on. And the next time their pet needs something done, they're more likely to get you in there and see you. They already start to know you. And so the referral aspect from coming off of these ancillary services for current clients who really haven't been using some things, but now I come in and I'm getting a groom and I'm seeing you're doing some underwater treadmill, right. And I sit there and I watch it and I go, oh my God. Or I see that, yeah, you're doing some training, but my dog is really having some shoulder pain, and now I see that you're doing some acupuncture as well. So it introduces folks to the medical side that we don't necessarily have the opportunity to. And I don't think that's ever factored into the potential referral aspect to the medical services. And that part really isn't captured. I know it's hard to do, but you've also got to consider that as well. Yeah. So one other thing, just in design.
Yeah.
Because you look at this, and we have a serpentine wall. We wanted to make that real comfortable, soft curves.
Pretty, absolutely.
Absolutely. The wrought iron fence, the street lights, the design of the exam rooms, the trees, the blue sky. After we had got this, and we were starting to put this together, my son, who is just completed medical school, he's a third-year resident. Yeah. But he's looking at this, and he says, "Dad," he says, you know who else is doing this? And I thought, oh my God, he has seen other veterinarians doing this. And he goes, you know who else is doing this? I said, no. He said, children's hospitals. I said, really? I haven't been in a children's hospital in 20 years.
Right.
And he said, because he has done his part of his rotation has gone through the children's hospitals. He said the new children's hospitals are doing this exact same design and making it look more like a park and a feel, he said, to help calm children down. Right. And I said, well, that's what pets are. For a lot of people, they're their children. And I said, it certainly makes sense, I think, and that's why we started to do it. I'm glad to see they're doing it on the human side. Maybe they'll catch up with us soon, huh? So, yeah, when he said that, I had to laugh. I hadn't even thought about it.
Well, have you been also pediatric dentists?
Yeah.
Like you go there, it's like a trip to the amusement park.
Absolutely. And,
hey, how are we doing? And